getting just superb results. We have another gentleman, and I have this documented downstairs in the booth. A gentleman started the Chaga, and he had a PSA at the time of 158. Now, gentlemen, how many of you would panic at 158? Probably everyone in the room, okay? Well, he didn't. He was supposed to come back in a month, so he decided to go to Mexico for a month of vacation. And he came back, kept his appointment, and had his PSA taken, and it would drop to 0.15. 30 days, one bottle. Does that happen for everybody? Unfortunately, probably not. But if it does happen for one, is it likely it's going to happen for a whole lot more? Absolutely. Okay. Now the doctor says, so what did you do? What clinic did you go to in Mexico? What did they use to help you do this? He says, what are you talking about? I didn't go to any clinic. What are you seeing? So when the doctor said 158 down to 0.15, he says, the only thing I've been doing is taking this product since I've been gone. I was on vacation. I didn't go down there to go to a clinic. And the list could go on. I have another lady who had an inoperable tumor in her brain, had tentacles growing from it, so that's why it was inoperable. She goes through Duke University, and I understand they're working on doing some documentation for this whole thing. And even after going through their protocol, the tumor is still growing. So she gets started on the Chaga. Somebody is, nice enough, caring enough to introduce her to Chaga, not knowing if it will work or not. But she's been told she has about 3 months to live. So she starts taking Chaga, and she gets up to a bottle a week. And in 7 months' time, she has a review with the doctor. They take all kinds of tests. And she's told, we cannot see the tumor anymore, and there are absolutely no metastases anyplace else in the body either. Then I can tell you about my group of I call it my geriatric group. I feel I'm a geriatric sometimes. But anyway, I have 3 ladies in that group that are 83, 1 man that's 90, another man that's 91, and then 1 lady is a youngster, she's only pushing 80. And of these ladies, this group, I went around the room when I made a presentation one week, and I said, tell me your update. They'd all been on the Chaga since about January. And so a lady by the name of Doris started. Now, Doris I've worked with for the last 10 years. When I first met her, she was on 5 heart medications, and we got her down to 1 within a month. And then we've done some other things along the way. She had a series of heart attacks when she was in her 40s. She is 83 now, today. And so she is on, she has a congenital, what do you call that? Congenital heart, no, that's not it. Congestive heart failure, okay? So she has to watch. She's only allowed to drink X number of liquid milliliters per day. And that includes soup and juice and anything else. So they have her also on a potassium pill and so forth. Anyway, she has now been on the product about 11 months when I asked, no, 10 months when I asked the question of all of the group. And she says, well, I'm not using my cane anymore. My knee feels much better. She says, and my platelets that at one time were up to 600,000. She was going every 2 weeks to get a blood test. It's very dangerous. We got it down to every 2 months, and then we introduced her to Chaga, and now she's going in every 3 months, and her platelets are normal. Normal. She says, but beyond all that, she says, I just feel so good. She said, I feel so good all the time. She says, I just, and these people are happy. They're not sluggish and drones, and they're just upbeat and happy all the time. So Doris says, I just feel so much better than I have in years. I just feel great. Then we go around the table, and everybody agreed basically to the same thing. I just feel so much better than I did before. And sometimes people can't really tell a difference. You know, we all want to feel it, right? And sometimes you can't always feel it. Like the guy with PSA count. Did he feel his PSA was that high? No. But the blood test, or the PSA test proved it, okay? So I could go on and on and on about all kinds of testimonials, but I think you get the gist, right? For me, I feel great. I have for a long time. And I love to tell my story that I don't care how old you are or how bad your health might be today, and that's why you're here looking for answers. My story is that I'm one of 7 kids. Some of you may have already heard this. I'm smack in the middle. 3 older, 3 younger. My dad died in 1960, no, I don't know what year. He died at the age of 60 of a heart attack. It was actually his 3rd. He was fortunate because most people go with the first heart attack, right? So he died at the age of 60. That's young. I mean, how many of you think 60 is young today? It is young, you know? It is. Okay, and then my mom died 17 years later of cancer. So I suppose with all the aunts and the uncles, you could say that heart disease and cancer runs in the family. Well, in my opinion, it runs in almost every family anymore. Okay, so then, in 1999, my brother that's 3 years older than me died of cancer. He went to Walter Reed Hospital, that's the President's Hospital, right? With a tumor right here, they called it bronchial cancer. They got it, absolutely got it out. But in about 6 to 8 months, they found 6 or 7 tumors in his brain. And needless to say, in another few months, I think about a total of 13 months after they treated him at Walter Reed, he was gone because the tumors in the brain got him. 1 year later, in a couple of months, my brother, younger than me by 3 years, got up on a Saturday morning, made a pot of coffee, walked upstairs to give a cup to his wife, came back down and dropped dead on the kitchen floor. 49 years of age. That gives me the chills. And he was my favorite brother, too. So I really miss him. But anyway, I'll go on. I have an older brother who has now had open heart surgery and just had his prostate removed. I have an older sister that still lives on a farm in Minnesota, which is where I originate from. And all of the crops, you know, are sprayed with so much herbicides, pesticides, whatever, that it has impacted the quality of the well waters. We lived on well water when I grew up. It was the best water I've ever tasted in my life. They can't drink it anymore because it's all been polluted. And both she and her husband have thyroid issues. And my sister has, I can't remember if it's Graves' disease or something else, but the one with the bulging eyes. And my sister, apparently, she did have her thyroid removed. But they both have issues. I have a younger sister, 3 years younger than me, who has lupus and smokes still like a chimney, doesn't take supplements that I know of, and a younger brother still 8 years younger than me that had a heart attack at the age of, I don't know what, 40-something. And fortunately, he was well connected and had a cell phone and sat himself down and called people immediately because he was by himself. And they got there and they got him taken to the hospital, so he's fine. But the moral of that story is that they're all on drugs of one kind or another. How many drugs do you think I take, over the counter or prescription?
None.
Big zero. Big zero. I started my lifestyle change probably about 30 years ago. And I lived with headaches. Constant headaches in high school. I took up to 23 Excedrin a day. But when you hurt, you hurt. And then I had an issue with my eyes, and then I had an issue with my head again was starting to hurt. And finally, I found somebody, it was a medical doctor, who finally discovered that what I had was a muscle spasm across the back of my neck and down into my shoulder. As soon as I relaxed that muscle, I hardly ever, if ever, have a headache anymore. In fact, in the last 10 years or 15 years, I don't remember a headache. I'm on no drugs. I do an awful lot of supplements. And I change them from time to time. I take a break from time to time. But the story is also, I had rheumatic fever when I was 10, so I've always been concerned with my heart. And they told me if I didn't have a relapse in 7 years, I'd be fine. And I have been, although I do live with a heart murmur, which is nothing much, I've been told. Okay? So, again, I don't care how old you are. I don't care if you're 20, 30, 40, 50, 60, 70, 80. You can still improve your health. It's not overnight with natural things and nutrition, but it all starts with your diet. Okay? Your usual daily intake of food should be predominantly fresh fruits and vegetables, a few selective grains, and I personally believe in eating flesh food. Not a lot of it, not necessarily every day, but that's my personal preference. I go days sometimes, 3-4 days without any kind of flesh food. But then I get to a point where I gotta have a bite of something, Give it to me. And of course, it's very difficult to balance your B's if you don't have red meat. But again, there's red meat and there's clean, organic, grass-fed red meat. So be careful. If you don't know a good diet, a simple way to do it is whatever you can go out in the garden and pull, or take it off of a tree and eat, that's pretty good for you, But if you have to let man adulterate it, put it in a box that's possibly dipped in formaldehyde so it deters bugs, or it comes through one of those things called a fast food window, avoid it like the plague. And if you can't do it 100%, start slow. How many of you have seen the movie Super Size Me? Oh, you've got to watch it. You've got to watch it. The story is that this man went in. He was his girlfriend was a raw food vegan, but she's vegan for sure, and probably raw food. So it just tore her apart. But he decided to do 30 days of McDonald's meals, breakfast, lunch, and dinner. He was in good shape. But he went in and he had 3 different types of doctors look at him. He had his blood checked, all the vitals and so forth. And actually the first meal he ate, and the other thing is when he went to McDonald's, he never asked for the super size meal. But if they asked him if he wanted it, he always said yes. Well, the first time he did it, guess what happened? He upchucked it all. It made him sick. Okay, so 15 days in it, he goes back and gets his vitals checked again. All 3 doctors say, you've got to stop this. You're ruining your health. He says, no, I'm doing this. So he did it for another 15 days, during which time he did get one appointment with McDonald's to discuss it. But after the 30 days, they wouldn't talk to him anymore. But they did, apparently, because of the movie, removed the supersized meals. I don't know if they're still there or not, because I don't go to McDonald's. Okay, but anyway, he really wrecked his health. I shouldn't say wrecked, but he really did cause a problem or create some issues. His cholesterol went up, his blood pressure went up, and he gained 27 pounds or something like that. Now, 30 days. It took him 9 months to undo the 30-day damage. So, I'm not saying that if you're 50 today, that's going to take you 150 days to undo it. 150 years to undo it. But start now. You'll feel better. And isn't that the whole thing? Don't you want to feel good until you... I pray that my final breath will be simply, I'm going to lay down and take a nap, and I just don't wake up. I do not want to have to live through what my one brother did, who was sick for the last 2 years of his life, debilitated with the cancer. If I do go, I hope it's a heart attack and it's like that, but better yet, just fall asleep like where our bodies are intended to. We have poisoned ourselves.